Thank you, Janine. Really appreciate it, and I think it really did a great job wrapping up kind of the summary of coalitions as they exist around our region. I really appreciate everyone's efforts to travel here, both from Oregon and from Idaho, to come share your messages and kind of the work you're doing in your areas. I'm excited to present our last punchline speaker for the day. Darrell Ruby has been a longtime coalition supporter and has changed roles. I'm going to let him elaborate on some of his recent changes, but we're excited to have him come and share a follow-up to last month's presentation by Lieutenant Colonel Clay Braun. Lieutenant Colonel came and gave a good premise for us to understand the Cascadia Rising scenario and the effects that would be hitting the state of Washington, both on the west side of the state and the east side. And I hope Darrell today can provide some insight into what's happening locally, and both from the Healthcare Coalition, public health, and emergency management perspectives.
All right, thanks, Travis. Yeah, so as he mentioned, I'm 4 days into a new job. Really, as a result, a lot of the work I did with the Healthcare Coalition and an appreciation for what the Healthcare Coalition has done through the years, and learning that the healthcare system is really, I think, pretty laudable in the sense that they really don't care about the jurisdictional borders. When a position came open at Providence Healthcare a couple months ago for a new position as an emergency manager, I asked about it and ended up applying for it and getting that job. So that's the job that I'm currently in. And so I'm really excited to be working with the hospitals and the clinics in Spokane and Stevens County, directly supporting them, continuing to work with the Healthcare Coalition, and really getting to continue a lot of the work that I've done for the last number of years with Spokane Emergency Management. So what we wanted to do, we've heard a couple of comments today about Cascadia Rising. How many were at the July meeting that Travis just touched on? So yeah, probably less than half. So I've taken a few slides from Lieutenant Colonel Clay Braun's presentation. My intent was not to go over those in very much detail. I might dwell on them a little bit more than I was going to, because about half of you weren't here, because there's really some statistics in there that are staggering, and we really want you to take a look at those. And I'll certainly provide an update as I can on some of the things that we have talked about doing. But more than anything else, we want to plant the seed some more, get some feedback from you all on what your interest is to participate in Cascadia Rising, and we'll give you some suggestions. I'll certainly suggest some ideas with that. But so I'm going to go through these slides. Right now you're getting handed out some talking points and some fact sheets that have the public health and medical objectives from the exercise. So please don't focus too much on those right now. If you can, we'll talk about the information on the slides, and then I'll get back to those towards the end of this presentation. So I'll also let you know that I took a couple of slides, actually all these slides, from a couple of different presentations, but one of them on here, I certainly hope it does not offend anyone. I don't think it's tremendously offensive, but it's meant to be for a purpose. So you'll see that in just a minute and what I mean. But so Cascadia Rising, it's based on a 9.0 earthquake fault. You'll see some additional information in this in just a little bit, off the coast of Washington and Oregon. Here's some pictures of previous earthquakes in various areas and the impacts and the devastation that we've seen from them. This one, as it says, is going to be a 9.0, the piece that I warned you about right here. And really the big idea from this is incrementally earthquakes from a 9.0 or a 9.1 have a dramatically more significant effect. And so that's really all we're trying to get with that, the person that I stole this from. But you know, if it's an 8.5, 8.6, some of us that aren't very smart on earthquakes, myself included, I'm learning a lot, are going to go, it's not a big deal, it's a 0.5 to a 0.6. What I've learned from the scientists is it's a dramatically bigger effect. So that's really what we wanted to take from that. So real quickly, again, these are some slides that we saw in July. All of those, as Travis has said, the information is historically captured on that srhc.org/HCC website. The presentation from Lieutenant Colonel Clay Braun, which are some of these same slides, are on there in much more detail and recorded. because really Clay Braun goes into some great, fascinating detail. And so this is the threat that we're talking about. It's the Juan de Fuca fault that's off the Oregon and Washington coast. So as we heard from our eastern Oregon partners, North Idaho is participating in this exercise. Actually, the state of Idaho is. And so really the big idea for us today is to learn a bit more about it, talk about it a little bit, and understand what your interests are, both locally and at your organizations, but also regionally, and how we might participate in this. So the exercise, which is in June of 2016, I'll show you the exact dates here in a little bit, is very intentionally on February 6th at 9:40. It's a Tuesday. So not to go into great detail on that, but kids are in school. It's February. So just one thing to think about is, so it would be a much different event if this was on July 4th or in the summer months when the beaches are full. And so as we look at some of the statistics that have been modeled here, just give some consideration to that and think about how that might impact the events. The other thing, as Clay highlighted in his presentation, and it's important to know that the modeling that we don't often have done in our business stopped at the Cascade crest. And there's a number of reasons for that, but really the biggest takeaway in my mind is we really do not know from a modeling impact what the impact of this event is going to be on Eastern Washington. And that's not to say that, you know, Spokane is going to experience a 9.0 shake and fault, and we really should know that, but it certainly is going to travel farther than the Cascade crest, and the sooner we can understand that, the better. But like with any plan or any exercise, there are assumptions and factors to go into it, and it's important that we recognize that the modeling for this exercise did stop at the Cascade crest. And the other thing that's, I think, important to note is there's an awful lot of planning with Eastern Washington at large that needs to still take place. And frankly, I don't think there's interest in doing it from our West Side partners, from our state agency partners. I don't believe there's the capacity right now to engage in that discussion to the level that we need to before the exercise. So I think the more we can learn about it and participate in it, we'll have those conversations post Cascadia Rising exercise. So here's some of the secondary effects. I'm going to go through the next following slides pretty quickly, because what we really wanted to spend some time with that we didn't have at the last meeting is having a little bit of a conversation with you all and trying to answer some questions, but more importantly, take some of your questions and ideas to help us better plan the exercise participation. But the secondary effects are going to be pretty dramatic, as you could understand. I actually had meant to pull these out because you can talk at length about a couple of these, but the ground shaking, you know, these are pictures taken from earthquakes throughout the world or tsunamis throughout the world. In the case of, actually we don't have the one picture that I was going to show here of the boat from the Japan earthquake. Maybe there we do. That you know, ends up on a building. So the effects can be pretty dramatic. Oftentimes the majority of the deaths, as many of you know, don't come necessarily from the earthquake, but it's from that follow-on tsunami that will most likely follow. So this legend, real quickly, take a look at this. It's kind of the stoplight chart, red, yellow, green, you know, and burnt orange or burnt red or darker red means completely or totally destroyed. So as I go through these next slides and you take a look at the numbers that have been modeled, you know, take a look at the severity, the impact on this incident, which is certainly going to impact dramatically the west side, but it's going to pull in our east side and really the entire nation, because this is an event on the order of magnitude that we really haven't seen before in our country. And if you talk to the scientists, we're overdue for it. But we also don't have very good prediction of when these things are going to happen. So EOCs, just take a quick look, a couple of numbers to take a look at. The result is that 37 of these must devolve. They won't be able to function at all. And the state EOC sustains slight damage. For those that have ever been to the Washington State EOC, it's built on some ball bearings and designed to take some of these things. and that's a really good thing. Most of the rest of the EOCs are not built to that standard, and so they're going to be impacted dramatically. Communications facilities, I'll come back to this a little bit later, but communications is going to be impacted dramatically. Power outage is going to be impacted dramatically. Some studies have shown that Eastern Washington might be without power for 7 days. So think about that for a little bit. Many of our hospitals have got fantastic backup generators and fuel and other things, but are you capable and ready to sustain that for 7 days? Now the impact of that is going to be, as I understand it, and I've asked a couple of questions, and I'm certainly not very smart on this, is really going to be driven by how quickly they can reroute the grid that's impacted from the event in Western Washington. So it could be sooner, but it might be 7 days, it might be a little bit longer. I don't think we fully understand that. So hospitals, this is kind of important to this group. Take a look at a couple of the statistics there. 45% of the hospitals are assumed to are reduced capacity. And then at the bottom, no hospital west of the I-5 corridor is going to be able to operate. We've got some numbers from the study on number of patients and transport people. But the other thing that I think is important to take a look at, this is really an impact structurally. So it doesn't take into account some of the impacts from electricity and potable water and sanitation that's going to be out, and then the cascading effects from that. Senior living facilities, again, this is going to impact mass evacuations and patient movement and people that are going to have to be moved. Fire stations, that's just a mass. There's a lot more of those. That's why this is a really busy slide. But again, the numbers in those impacted, total reduction is assumed to be 33% of fire response capability. And so, this is a really bad event, and we're starting the game at 1/3 reduction of our normal first responders from fire. Police stations impact, similar numbers and impact. Corrections facilities, some might say, well, why do we necessarily care about this? You're going to have a lot of people that are probably going to be released from this, or maybe some resources, depending on how you look at it, that we could utilize. But it's a group of people that, when we talk about our vulnerable populations, we don't necessarily want them to have direct and immediate access to kids and other groups, so it's part of the equation we need to think about. Speaking of vulnerable populations, our schools are going to be dramatically impacted. And again, this event is based on a Tuesday morning, 9 o'clock, so school's in session, people are at work. For those of you that are parents, what is your natural instinct going to be? Is to go get your kids, protect. And the infrastructure is going to be dramatically impacted, so our ability to do that is going to be severely degraded. Let me go through these quickly. So yeah, transportation, highways, bridges, severely impacted. Utilities. Again, these slides, you can take a look at them, and I really do encourage you to do that. We encourage you to have some conversations with your organizations looking at these numbers and just brainstorming, hey, what would this mean to us? So this is kind of a key takeaway. So take a look down this. Population impacted towards the top there is just under 7 million. Exposed to the tsunami, 50,000. The reason that's important is because that's really the killer of the significant number of people. Keep in mind the comment I made earlier, this is a February. If this was a July or a summer month, the number of people exposed to that tsunami would be dramatically increased. And again, we don't understand very well when these things are going to happen. The other numbers that are kind of staggering is the mass feeding hydration people, 1.3 million. Mass feeding hydration of pets. Do we care about pets? We absolutely care about pets because people care about pets. So it's something we need to factor in. Deaths. I'm told the death number is actually lower than what was modeled, and they did that intentionally. It's above 10,000 or maybe even close to 12,000. And then the injuries. Hospital patient evacuations, nursing home evacuations. So really, you're almost looking at 100,000 people to be evacuated or dead. The deaths are going to have to be verified. So really a scale of a problem that's dramatically larger than anything we've seen ever, really, in the U.S. And we've seen some big events. So some historical comparisons, and Lieutenant Colonel Braun touched on this, but this was modeled just, so you understand what it was based on is the 2011 impacts in Japan. The point that was kind of sobering, I think, from the presentations I've seen on this is keep in mind that Japan is really the best prepared nation in the world for earthquakes and tsunamis. They actually have tsunami walls that the tsunami that they had topped. So compare that to the U.S. We got to be number 2 or 3, right? In the top 5. I doubt we're probably even anywhere in the top 10. I mean, we're not very prepared. So, comparing that to Japan, I think is a good model. And really, when you compare it to the science that went into it, again, what I've learned so far is it's a very realistic modeling that was done at 9.0 and the impacts that we're going to see here. So the key takeaway is it's not unrealistic. It is absolutely something that could happen. So what does that mean to us? So take a look at some of the documents that you do have in front of you. The next couple slides are really going to be taken from those. So there's some public health and medical talking points for Cascadia Rising. That's a nice one-over sheet to take a look at that focuses on the background and the scenario and some of that information that I just touched on. There's a public health and medical exercise overview that goes into some of the DOH planning that's been done. And I will tell you that this planning has evolved quite a bit since we printed these sheets. Patty Richards is participating in the public health and medical planning group when she can, mostly remotely. But the reason I highlight that is because there's an awful lot of meetings that are going on the west side, and she's just not able to make it over there, but she's trying to stay engaged. So as we go forward with your input and ideas and questions and concerns, keep in mind we're not going to have direct impact on the objectives that are already established and the plans that are happening on the west side, but what we really want all of us to start thinking about is when we do our trainings and our exercise and the workup events between now and then, to include the alternate care facility drill that some of us are participating in this Saturday, that's a very, very, small event. We're going to inventory the alternate care facility trailer. The Medical Reserve Corps here is in Spokane. We're going to talk a little bit about Red Cross co-location shelters with an alternate care facility, on kind of a small scale. But let's supersize that and look at it if it's a Cascadia Rising event. How might that look? So if we can start thinking about it in that context as we do the small incremental trainings and exercises we need to do, I think we'll be better prepared not only to integrate into a Cascadia Rising, more importantly, we're going to be ready if and when these big events happen to support whatever the area or the region that is impacted is, whether it's the west side of the state or whether it's a large catastrophic event in eastern Washington or North Idaho or with our partners in eastern Oregon. And then the third sheet you have is very similar to the other, but it really just goes into detail on the Department of Health tactical objectives. So those are really just to take a look at. What we encourage you to do is look at them today. Ask some questions of me or Travis or Patty, but more importantly, take these back to your agencies and organizations and at your staff meetings or your department meetings or your organization meetings, as you can, have some discussions about this and what you think the impact might be, and then try to bring those to the Region 9 Healthcare Coalition to help us integrate these to a degree. So I'm going to go through these kind of quickly. We're really talking about Emergency Operations Center coordination, operational coordination, at a large scale, and communication is going to be key. So if our traditional communication infrastructure is down, which it will be, how are we going to communicate? Do we have any amateur radio aficionados in here? Any ham radio, amateur radio folks? Okay, we have one. Excellent. We'll definitely tap into you, Michael, although you might be busy elsewhere. No, but really the big idea is going to be we're really going to leverage amateur radio. And I tell you, those folks, if you've never worked with them, are a fantastic resource. And they love doing this stuff. They do it, you know, almost daily, many of these folks on their own. They can communicate pretty well. They are data limited. And look at our day-to-day business and how data intensive the things we do. So we need to figure out how to slim down, you know, our 10 megabyte files that we like to push through the email systems, and figure out how through the systems that they have we can still communicate and keep that situational awareness and understand, you know, priorities that are affecting really, really large areas of Western Washington. So communication is going to be really challenging. Transportation is going to be severely impacted. So think back to the wildland fire events of this summer. Pretty small scale when you compare them to this, and some of the challenges we had with patient transport. You know, and there's some great partnerships out there that we leveraged this year, but we really are going to need to think about this on a much larger scale. And how can we integrate all those, communicate, keep people safe, so we're not adding to the problem that's already devastating. Fatality management, you saw the numbers around 8,000, 10,000, something like that. It's going to be much, much larger. So what does our mass fatality management plan look like? Our Family Assistance Center planning, which is an area we've focused quite a bit on here in Spokane, and how can we leverage those lessons learned in the trainings and the exercises we're going to do. And so then this last slide is really, you've got this on your slide, so I'm going to go to the last couple slides and then hopefully take some questions from the group. So the exercise itself, please put this on your calendar. And there's a couple of different things that are happening, but June 7th through the 10th is the date of the actual Cascadia Rising exercise. And so at the very least, what we'd like to encourage people to do is be aware that it's happening. You know, if nothing else, on these dates, get up on WebEOC, get up on WATRAC, get up on some of the other systems that we're going to have out there. Information will be shared in sit reps and things like that, and pay attention to it and talk about it with your staff. More better would be to try to travel over to the west side and participate in a hospital or at a jurisdiction level as an evaluator or a controller or simulation cell, or just as an observer, so that you can experience firsthand and really better understand the impacts of this catastrophic event. But there is not a lot of participation planned right now from Eastern Washington that I'm aware of, that I don't think, although that's something we're trying to solicit. So if you guys have plans or ideas, help us understand what those are. But really, for the most part, what we're encouraging people to do on these dates is to try to get to the west side. The other rub on this is there isn't a lot of money, you know, grant money identified, but there might be some, and there might be some creative ways that we can use the money we do have to get people over to participate in that. And so if you can do that as an agency or an organization or, you know, the tribes, please take a look at doing that and plan accordingly through the year. So the bottom objectives are really just an overview of all the different types of activities that are going to be going on, regardless of the core capabilities that we look at, whether it's the CDC, public health ones, or the FEMA DHS core capabilities. It's really going to touch almost everything we do on a scale that we've never seen. So for the next couple minutes, or really as long as Travis will allow me to stand here, or you guys have questions, what questions do you have or ideas do you have about other ways to participate? Because I know really you've probably got some creative ones that we haven't thought of and might be pretty easy to integrate. So please keep in mind, use the microphone. I think Susan will help with passing that around. No idea is a crazy idea. Please ask it if you have it on your mind. Yeah, so what Travis was just asking, for those that might not have heard, especially on the webinar, so what are your plans already if you're planning it? And I know North Idaho has had some pretty intensive planning efforts already. Oregon, I was surprised to learn that you guys actually had done an exercise last year in anticipation, and it sounds like you learned something there. Maybe a simple thing that we could ask would be, would you share the after actions and lessons learned from that? We often learn a lot from those types of things. But what are some of the agencies talking about or planning to do already?
I think I can put this in a little different way. I would ask you right now, you don't have to answer me, just think about it. Are you personally prepared to be 72 hours to 7 days without power? And how are you going to do that? And then next, is your business or the agency that you work for prepared to be 72 hours to 7 days without power? And how are you going to handle that? And all we're saying is during this time, take advantage of this scenario already being developed for you, already being practiced. Do you have a way to communicate with the people that you work with your family? Is that ready? Is it ready now? Can you prepare it before this time? It's an easy thing to do, to create just a drill, a call down with your family and with your company that you work for. Just test your communications. If they work now, they may not work then, but what's your alternative then if that doesn't work? Continuity of operations. Is your company ready? How are you going to handle this? So please just, in your own mind, start phrasing this and looking at this. Can you run with this scenario some sort of a drill or an exercise or just a tabletop? Just talk about it with the key people at your company. Are you ready for this? Can you do it?
Yeah, really good summary. Thank you, Patty. Any questions or comments? Please, as you go back, take a look at these objectives. As Patty said, think about the impact on you individually, as an agency, as a community, whatever that community might be, as a region, and recognize that it's going to cross multiple jurisdictions, traditional jurisdictions that we oftentimes get hung up with and impact us on a really, really dramatic scale. So just kind of in closing, a couple of comments. September is what month? National Preparedness Month. Yeah, thank you. So if you and your agencies are not doing anything for National Preparedness Month, please do. You've got a few days left. This week, if you've been playing along with the DHS FEMA calendar schedule, anybody know what this week's focus is on? Another day. Okay, so this week is electrical outage. So it kind of ties to what we were just talking about. So I had an interesting discussion this morning at a Providence meeting I was at for Sacred Heart. I'm excited to finish touring Sacred Heart. I still get lost just walking to my office in that massive building. But a better understanding some of the backup power generation systems that they have. And then next month, October 15th at 10:15, if that helps, great shakeout. So really what I encourage you to do is register your agencies, register your family. Last year, Washington State hit our goal of 1 million registered people. You're going to see a big push between now and then. A lot of us in Eastern Washington go, well, we don't have much of an earthquake threat. Why should I care? I would submit to you that we do have a greater threat than we understand, and we're studying that. The scientists are, and we'll learn more from that. I won't ask how many traveled to the west side because I think it's probably every one of us. And so what would happen to you if this 9.0 happened tomorrow or next week or next month when you're on the west side? Are you prepared? Do you understand how to do the drop cover and hold on for 5 minutes if that's how long it's going to shake? So, we sometimes kind of brush these things off, but science has shown us and research has shown us that we're much better prepared when we practice for these things that are going to happen. So please focused on National Preparedness Month, the great shakeout, and just around the corner, winter is coming. So think about those hazards that face our communities. Thank you.